Sir, how vitamin D will reduce the severity of ICU in COVID?
Okay, again vitamin D3 or vitamin D reduces patient entry in ICU with COVID infection, right? Basically, any patient with COVID infection, if enters in ICU, then there is a cytokine storm. Entry is because of cytokine storm. Okay, I will explain what is cytokine storm prior to again come back to the point of vitamin D3. If vitamin D3 levels are reduced, what will happen? CRP, C reactive protein levels will affect. Levels will affect. High levels of CRP creates inflammation in our arteries, right? So if vitamin D levels reduce, then C-reactive proteins level also gets affected, right? And one more thing, if vitamin D levels reduce, what will happen? We have immunity which is going to respond the first, that is called innate immune response. Right? They are the first to respond whenever there is pathogen in our body. Let me explain. Suppose this is a cell wall. Right? This is a cell wall. And a pathogen enters. And now this pathogen is happy because it knows that we have one more immune response, that is called adaptive. Right? And this adaptive immune response is going to be built after 7 to 10 days. So this pathogen is happy now. This pathogen knows that it can multiply. There is only innate immune response is present, right? And there is no adaptive immune response which is of delta, which is built by our T cells and B cells. They come in action after 7 to 10 days, right? So this pathogen knows it, that there is only innate immune response which is trying to prevent this pathogen by entering inside the cell. But till 7 days this multiplies here because there is no adaptive immune response. There is no response from T cells and B cells. Right? One more can help to stop this multiplication is vitamin D3. So if you have good levels of vitamin D3, if we have good levels of vitamin D3, they make our immune proteins called defensin and cathelicidin. These two proteins are immune system proteins and they prevent multiplication of viruses. So what they do? They prevent multiplication of virus. So vitamin D3 is definitely going to prevent a patient's entry into ICU. If you have good level of vitamin D3, they will manage the CRP level, right? C-reactive proteins. Then they will increase innate immune response. Who are the innate immune responders? We have neutrophils, we have macrophages, we have dendrite cells, we have mast cells, and we have coming good response from vitamin D3 of defenses and cathelicidins. So they won't allow this pathogen to multiply. If these are multiplied in this absence, what will happen? Till we get the response from T cells and B cells, they will create a huge number of viruses. And once these T cells and these B cells are activated, they start creating a strong effect. They start creating cytokine storm, which is going to destroy. So once T and B cells are activated and now they know there is a lot of virus multiplication, they will create cytokine storm. And this cytokine storm will less damage these viruses but more damage to us, and our entry is for sure in ICU, right? So make sure you have enough vitamin D3 to manage these all responses. Thank you very much.